Hello, once again, I'm Pastor Bobby D. Hamilton. I welcome you back to Pastor B's Kitchen Table. This is a place, as you know, where we chop it up and break it down and put it back together again. We've been talking so much about families and so much about relationships, but today we're going to take a little hard right, and we're going to talk about something that's very prevalent in the land right now. We're going to talk about what's going on with this Covid-19. We're going to talk about this virus that's going on, because I know that's on your mind right now. And somewhere in your home or your apartment or wherever you live, you got some of these same items we've got right here. And I'm quite sure that these are things here, wipes are like kind of like gold right now. You wish you had them and you need to have them. And so we're certainly in a different time, we're in a different place. But I always have said, even in the churches, that God gives the body exactly what it needs. And so everything is inside the body. The gifts, the abilities, the experiences. And so having said that, I'm just honored. I'm tickled pink today to have joining us today, Sister Carla Davis, in fact, Dr. Carla Davis. Will you say hello, Sister Carla, and tell them who you are?
Okay, my name is Dr. Carla Davis, and I'm a member of Friendship Community Bible Church, as well as a physician. And I'm a pediatrician at Texas Children's Hospital.
Amen. And she deals with a lot of things related to our immune systems, and you're really in the heart of that.
Yes, I'm the chief of the section of immunology, allergy, and retrovirology.
Okay, so you see, we really got someone who knows what they're talking about. This isn't coming off Wikipedia or Google. She's actually there. So we're glad to have her today. And then we got people asking questions, and so as opposed to trying to come up with our own barbershop or shade tree mechanic answers, I want you to just kind of address some of these things we're dealing with today. And so the first question is what is the origin of this? What is the origin of COVID-19?
COVID-19, we think, actually developed, or I should say mutated from an animal.
Okay.
We think it came from potentially bats. There's still investigation into whether that was the true cause of it.
Right.
But it was thought to have originated in Wuhan, China, in the province of Hubei. And there was an animal market, and so that was the first place where it was detected. But many scientists think that because it spread so quickly, it may have actually been circulating before that time. But we do think that it's a mutated virus from an animal, and we think that was a bat.
So some kind of way it came into contact with humans.
So yes, so it would, while in the bat, it actually mutated, so it was able to infect humans, and then it spread from there. And now it spreads through person-to-person contact or respiratory droplets in the air.
Wow, okay. Respiratory droplets in the air. Because one of the questions someone was asking is that, is this thing airborne?
So if someone coughs or sneezes, then it would be, in those respiratory droplets. So, but it would then fall to contact, and fall out of the air. So it's not airborne indefinitely.
Okay.
We don't really know how long it kind of stays in the air. There's some reports that if you use a nebulizer machine for asthma, where you do the medicine, then it could actually stay in the air for up to 2 hours. So people now are saying don't use those. Use the little puffer inhaler.
Wow. Interesting. Okay. Another question for you. It's hot off the presses here. What effect does this have on children?
So children typically have a milder disease than older adults. Children can get upper respiratory symptoms, or we're finding actually that they can be asymptomatic, so they can actually not have any symptoms, but still have the infection and still spread it. So things are changing rapidly. What I tell you today, I have to tell you, what I tell you today may not be the same information that I would tell you in a week or that I would have told you last week, just because this pandemic is rapidly evolving. And so right now, we know that children are typically mildly affected, so they have kind of upper respiratory infection type symptoms, or they can be asymptomatic.
Wow. Okay. Face masks. pros and cons.
Yeah.
I've seen people wearing Home Depot masks. I saw a lady in the grocery store. Literally, she had on a pair of rubber gloves up to her elbows. She had her hair tied back. She had on some lawnmower goggles. And she had this big old face mask on that I know did not come from any medical outlet. Mm-hmm. It's like something that came from, if you're going to cut down some shrubs or something. Yeah. So, do they work or do they not work?
Well, so face masks can, if you cough, stop the respiratory secretions from coming out. So if you're sick, or if you think you have all the symptoms of the COVID-19 disease, then it makes sense to put on the mask, and you're really protecting other people, right, from actually contracting the virus. And so, in the context of kind of all of us in regular everyday life, wearing a face mask would be appropriate if one were sick and needed to protect other people.
So it's not the inverse, it's because they're wearing to protect themselves from people.
Yeah. So that is typically not effective. And right now, these face masks are really in short supply in the United States.
Okay.
So even in a healthcare setting, healthcare doctors are not using the face mask unless there's a patient that has fever, cough, and shortness of breath, which are the most common symptoms. And we think that they might have the disease. And so at that point, then the patient is given a mask and the healthcare worker is given a mask. But again, even in the healthcare setting, when we're around a bunch of sick people, we're not wearing the masks unless we really think that somebody has the virus.
Okay. So I hope you heard that, what she's saying about our mask, because I know some of you got those masks and you just wearing them to prevent people, but I hope you understand the requirements of it. And just some kind of guidelines is how you do it. That's important. I think we were kind of all thrown for a little loop. I know those who are sports fanatics, when we saw these professional athletes who are being diagnosed with it, but they're asymptomatic. Now that I know for a lot of my sports buddies, that when the pros got it, because they're fine-tuned machines. And they got it, but not showing symptoms because they keep saying, I feel fine. So what's going on?
Yeah, well, 80% of people who get the virus have really mild symptoms. And so professional athletes who are in great shape, it's not surprising to me that they really wouldn't have a lot of symptoms. They may just have a little cold symptoms, nasal congestion or something like that. We do know that people can get infected with the virus and again not have any symptoms and later on develop the symptoms. The incubation period is a median of about 5 to 6 days. It ranges from 2 to 14 days that the virus can stay in your system before you get symptoms. So during that time, you can still actually transmit the virus. And so that's why public health officials in the city of Houston, in the greater Houston area, are saying that we need to limit contact because the only way to really get a handle and stop the spread is to prevent people from really contacting each other, especially if there's a person who has symptoms, because that person is especially contagious.
That makes sense now.
The virus, coronavirus, which is the actual name of the virus, is SARS-CoV-2. That's the name of the virus. And COVID is actually the coronavirus disease, 2019. That's what we call it. So, so we really are trying to prevent the spread because we know that people can transmit it even if they don't have symptoms or even if they have very mild symptoms. And so it's kind of trying to protect the older people because essentially 80% of the deaths occur in people who are 65 years and older. And so we don't think that the professional athletes who get it, the children who get it, the millennials, the young adults who get it, they're not going to be the ones typically that are going to be in trouble. It's going going to be the older.
Older one.
Yeah,
Yeah, because
older
that's some of
adults.
these millennials are still on spring break.
Yes,
It's
yes.
crazy.
So yeah, that's why at one of the CDC press conferences,
Right.
actually I think it was a White House press conference, they mentioned that really the millennials are going to be the ones, if they take charge
Right.
and determine that they're going to do the right thing for the society and self-isolate and just separate, they would be the ones to be able to stop the transmission and the spread.
Wow. A lot of that group that I'm talking to, they think it's a hoax anyway.
Yeah.
So they don't believe it's real. So and yet I see what you're saying.
Yeah. Because coronavirus is about 3 times as infectious and contagious as the flu.
Right. Okay.
The flu causes about 0.1% of deaths. And the coronavirus causes 1 to 2% of deaths. So it's about 10 to 20 times more deadly.
Right.
And the real concern now, you mentioned that the Clorox was, it was really in short supply, even face masks and so Purell. And because the United States has gotten the virus after so many other nations have gotten the virus, we've been able to actually see what's happened in those other countries. And so what we don't want to happen and why we want people to self-isolate is because in other countries, you may have seen in the media, that in Italy and other countries, the way that this country runs the healthcare system is to care for the people who are currently sick, not necessarily to take care of 100 times that many people. So we want to just make sure that in our country and in our region, we can take care of everybody who gets ill.
Talk about for a minute, Carla, if you could, about immune system, because you said there's certain people whose immune system makes them a little more susceptible. Talk about that for a minute.
Yeah, so there are certain high-risk groups, and older people in general have what we call senescence of the immune system, meaning as they get older, the immune system just doesn't work as well. They become more prone to getting infections. And so we know that there are other groups besides older adults that also are at risk of having more severe disease. Those are people with chronic medical conditions. Chronic illness can actually cause the immune system to weaken. Those conditions include heart disease. Even in Italy, hypertension was something that was a big risk factor.
Really? Hypertension?
And then chronic lung disease and diabetes. Those were the real 3 kind of major things that we're seeing in the Chinese population that have been reported with coronavirus. And
say that again. You say diabetes, hypertension,
and chronic lung disease.
Chronic lung disease.
Yeah, those are 3 pretty significant disease groups that would be high risk.
What about people who previously have had cancer, or cancer treatments?
Yeah, so people who are immunosuppressed, we consider them in the high risk group. It's kind of interesting, in the early studies that came out, though, those groups weren't highlighted as groups that had more severe disease. So we think that, yes, it does give them more susceptibility, but we haven't really seen in reports that there are a high number of severe cases. So, but I do think that for people who have had cancer, have had chemotherapy, and have a weakened immune system, yes, they are in a high-risk group. Anybody who's immunocompromised or who has been taking medication to weaken their immune system would be among that category. And then another category would be pregnancy. We don't really have a lot of information about pregnancy, but right now we think that pregnant women are in a higher risk group.
Carla, how do you boost your immune system?
That's an interesting question. A lot of people, have a lot of herbal therapies. There aren't a lot of really. There's no medication that can really help that. We know that when people are stressed or when they're sleep deprived, they can weaken their immune system. So one thing I would say, just on a chronic basis, if somebody's not getting any sleep or is constantly stressed, they may have a weakened immune system that would be improved if they actually rested and were able, to relax and do things that help them to relax. And so, in some cases, you may have heard also that there's some studies that say kind of vitamin C and kind of larger doses can help get rid of the common cold. And so, there's some other herbal things that don't really have a lot of evidence to them in the literature, but yeah. So I would just say that resin in this particular case, I would say really not being exposed to coronavirus is the best way to not get it.
Best way,
There's no real way that you can. I wouldn't recommend taking something to boost the immune system and then saying, "Oh, I'm good," and then going and shaking hands with somebody.
Now, one of the questions I've heard, Carla, is what impact does this have on pets?
Oh, yeah, that's a good question. So there was one dog in China that was found to be affected with SARS-CoV-2, right? And it's not been shown that it can be transferred from animals to humans. Because the one dog was reported, we think the dog was infected from the human. And so theoretically, it could happen, but it's never been reported.
So those watching, you can breathe. Little Fluffy, you keep Little Fluffy. And I know for a lot of you, those animals mean everything. And so that was just a question that came down about what about my pets? What should I do with should I isolate my pets? And so, thank you. So I had one dog.
Okay.
They
just had one dog. They had a lot of dogs. Okay.
Carla, can you give us a little information about what if you are found positive? What is the actual treatment?
Well, right now we consider it to be what we call supportive.
Right.
So there are drugs that are being investigated, but there's no specific drug for coronavirus. So it would be similar to what you would do if you had the flu or another cold. So rest, keeping yourself hydrated. If you have fever, taking Tylenol. They recommend now, actually this just came out yesterday, to avoid ibuprofen. There's a theoretical risk that it may help the virus replicate in the body, but cough and cold medicine, I think would help. And you definitely don't want to go into large crowds or large places. So if you are in a household with other people, you want to protect them from getting what you have. So that'll be the time to wear a face mask, or if you don't have a face mask, stay in a room apart from the other people in your household and do the things that these products would help. So clean surfaces that are commonly used, and don't share glasses. When you're coughing, cough into a tissue, throw that tissue away. Wash your hands for 20 seconds, saying the ABC song, or use the hand sanitizer. And so I think it's important that you kind of separate yourself. If you need medical attention, though, you want to call your doctor and you want to alert them to the fact that you'd like to come because you think you have the symptoms of coronavirus. And that allows the doctor to be prepared for you so that you're not sitting in a waiting room with a lot of other people, getting a lot of other people ill.
Breathing on people and everything.
And then there's also a recommendation that if you get sick or somebody in your household is ill, then everybody in the household needs to stay in and be quarantined for 14 days. Okay, so if anybody is sick, the whole household needs to stay in the house for 14 days. They actually did a model to see from a public health standpoint, meaning looking at people in the whole nation, the computers, if we did this intervention, what would happen, or that intervention. And the biggest thing that made a difference was if the people who had the disease and everybody in their household stayed in the house, then that tended to drop the transmission. Significantly.
Here's another question, Carla, that came up. Is this virus racially biased?
The answer to that is a resounding no. virus. All ethnicities, all races, all people. And I'm just thinking about the reports from China, and there were just maybe a little bit more men, but pretty much everybody can get it. Everybody can get it, and so we all need to be.
There's no respect to a person.
No respect to a person.
Okay. Physicians, you're there. How do you guys prevent from getting it? What do y'all do?
Well, the same thing everybody else does, really.
Yeah. Because you guys are around it all the time.
Well, not so much.
Yeah.
I think right now.
Okay.
We may be in a week or so.
Right.
But right now, for people who we suspect may have the symptoms, again, a cough, shortness of breath, or fever, if right now for every person that shows up to a doctor's office or hospital, there's some probably or should be some screening measures in place so that everybody gets checked. And if everyone gets checked, if anybody has a cough and fever, shortness of breath, then that person gets shuttled straight into a room, a private room, and then the doctor puts on a face mask and what they call PPE. I don't know if you've heard of this, personal protective equipment. And so what the PPE that doctors put on includes one of these plastic gowns.
Oh, yeah.
The plastic gowns, and we have to put that on, the face mask, and then gloves. And so you what they call don, or put on the PPE, and then we go into the room and see the patient. And if we think that this patient needs the testing, then we can do the testing. It's done through a nasal swab, nasopharyngeal swab, and then send that. And the patient, before the patient would walk out of the room, would also get a face mask. Okay, and so then we would come out of the room, take off the personal protective equipment, and use a lot of hand sanitizer. Kind of before and after that process. So that's for the suspected people who are under investigation for the illness. And so that's pretty much right now what's happening. There is some concern, you may have heard about it, that there are not enough supplies. So, as you said in your messages recently, God has not, coronavirus has not caught him off guard. He knows about this. And so I've been really encouraging other physicians to not be afraid. There is some fear among physicians, actually, that there may be a point at which we don't really have enough of this equipment or these face masks. And if that's the case, then our healthcare system would be in a situation where somebody like myself would then have to make the decision, am I going to take care of the patients without it and then risk death? There was a death of a physician recently.
Really?
Yeah, in Italy. That he was described as a hero because they ran out of it. They ran out of the personal protective equipment, and he said, "No, we just have to continue to see the patients." And and he passed away. Yeah, so I think there might be opportunities. I hope not. I hope that doesn't happen. But right now, hospitals and doctors are being very judicious about the use of the equipment and making, and also the use of the hand sanitizer, so that we can make sure we're ready for the entire epidemic, because we know it'll probably last about 4 to 8 weeks. Some people are saying maybe 12 weeks. So I think everybody's prepared for that.
Carla, in your own expert opinion, not going to publish this anywhere or anything like that, but not so much when it ends, but how does it end? How does this thing end?
Yeah, well, I think, so just as other viruses kind of come into circulation, just like that, like this one came into circulation, they go away. And so these viruses typically have seasons. And so there will be a time when the virus will stop replicating in humans, and it'll go away. And so we do not expect that this will last, more than 6 months. That would be very unusual.
Right.
And people always had a question about, is it going to go away when the weather gets warmer?
Yeah.
And, initially we didn't know.
Right.
We didn't know. And then people would ask me, well, and I would look at the map even. It's not in Africa. It's not in Brazil, right around the equator.
Right.
But really, the honest truth is we don't really know. But we do know it will end. And so we just want to make sure that during this season of replication, we're able to take care of all the people who get ill, because many people need to have help with a ventilator to help them to breathe. And so in Italy, for instance, where it's a bit out of control, the doctors have to make decisions about who to put on the ventilator and who to not. And so essentially, that person would die. Yeah, so we really don't want that to be the case.
How did it get like that in Italy?
I think probably Italy, the European nations, as well as the United States, we never really had to deal with this kind of virus like the Asian countries have. We may have, for the past decade, we've heard about SARS and MERS, and so the Asian countries have had some experience with dealing with that kind of disease. And so, although the SARS and the MERS, these other coronavirus type infections that are in the same family as COVID, they have a higher mortality, but they weren't as contagious. They weren't as infectious. So, so because the European countries, hadn't dealt with it much, thought it was like the flu. A lot of people in this country, right? Said it's just like the flu, it's just like a cold, it's going to go away, it's going to come, it's going to go away. So I think they really underestimated the impact. I think they underestimated how contagious it was. And so there were really no measures taken in the country to prevent the spread. And early enough. And so I think by the time they realized how many people were infected, they, it just overwhelmed. It was overwhelming. It was like,
Because you're right. Because initially you heard it's just like the flu, it's like a common cold, and it'll just pass. And yet this has evolved into something totally different.
Totally different. And I think the tenor. Even if you had talked to me a month ago, you said, well, how serious is this? I said, well, I think it's we just really didn't know. And so now we're getting a glimpse. And I think, all the healthcare, I work in the medical center. And so there's a lot of work going on in hospitals to prepare for this. Just to give you a sense, when Hurricane Harvey came in, it was about 4 to 5 days of kind of, mass, flooding and the services, disruption of services, and then we had an incident command center, and so it was kind of this disaster type response over 4 to 5 days. Well, over the past month, it's been pretty clear that we're looking at the same proportion of disaster, but on a healthcare scale, and it's going to go for probably weeks. So we have an incident command center, Texas Children's Hospital screening, and has cut down the number of entrances. You may have realized I went to HEB, and the HEB, there are normally 3 entrances, and now there's 1 entrance, and and then everybody gets a sanitizer. So these kinds of changes are in an effort to try to ensure that so we know that there's going to be a curve, and you may have heard about that curve. Probably a lot of people have. That as the cases rise, which we know they will, which it makes sense because people can transmit it before they get symptoms. We know that the cases will rise, and so what we want is is to try to stem how high that goes.
Yeah, right.
But it takes everybody for doing their part in order for that to happen. So that's why I think it's important that everybody really understands the impact. Right now, the CDC, I don't want to just, I feel like I keep talking. Okay. The CDC, they've gone down. It used to be 250 and 50 and then 10 people, in a room together. And I wondered about that, as well as other states around the country that are shutting down restaurants and shutting down bars. And but I heard just yesterday in Brownsville there was a quinceañera that had 150 people there. And so I think it's really important to be mindful that if you get together with a lot of people, the people could spread it to some of the older people that are the most vulnerable. It won't be the younger people. They'll just get a little illness, and I'm sure the basketball players, I would be shocked if any of them have any significant issues. But I think the concern is because the death rate is 1 to 2%. If we were to have, right now, the United States has about 7,000 cases and about 100 deaths. China had the most. It had 80,000 cases, and the death rate was around. It's in the thousands, about 2,000 to 3,000, something like that. And the United States is a pretty big country, so we have a lot of people. So the death rate, it could be in the hundreds of thousands in our country. And so we really want to make sure everybody knows.
If I hear anything you're saying for certain is that be mindful of not just yourself, but to others. So you may feel fine, I got this, but the impact you could have on someone else by being a carrier, they may have a compromised immune system, and your being there could impact them tremendously. That's what I'm hearing you say. Because most people, like you're talking about the younger people, they feel like I'm fine, no problem. But yet the impact it has on others who are around you, even within your house. So Carla, you're a parent, your mother. There are parents who are watching this. What would you tell a parent? What would you tell a parent now to tell their children?
I would tell, so it depends on the age of the child, but if it's a really small child, I would tell them to wash their hands and sing the ABC song, but before they eat, I would tell them cough into their elbow or their tissue in order to keep other people safe. I would tell them that there is a virus that's in the nation. A lot of kids are asking, why can't we go to school? So I would tell them, because there's a virus, there's an infection that's causing colds that could spread among everyone and then make the older people really very ill. If it were an older person, like a high schooler or a college age child, I would really impress upon them that their actions could influence whether people like their grandmother, grandfather, great uncle, great aunt are able to have a ventilator or not. They were getting ill, critically ill. And so really I would encourage them to stay in. And I've done the same for my kids. And I encourage them, but just like you said, Pastor, they said, I don't think this is a big deal. So we have those discussions.
And that's just a real deal. But when you talk about the impact of people whom you love, that you could contribute to your aging relatives to be on a ventilator, not have a ventilator, or live or die, or to be hospitalized, that's a whole different perspective, because that brings it close and brings it to home. One last thing. Is it true that if you touch your face, then you become susceptible to COVID-19?
Well, so one of the things that we recommend when you're out and about, and if you touch on surfaces, and you haven't washed your hands, then don't touch your face, or because COVID can get in if you just breathe it in, right? Or your eyes, you rub on your eyes, or anything around your mouth. But if you have really clean hands and you've just sanitized, then that's not going to affect you as much. But I would say that it is true that we all touch on our face about 100 times a day. I've heard, and we don't even realize it when we do. We don't even realize it. Yeah. So I think that it's the reason why we say don't do that is just because there are these portals of entry on your face, and if you have touched on something that has a coronavirus, which can last for up to 2 days actually on some surfaces, then you can get infected. Yeah.
Okay. Wow. Oh, last thing.
Okay.
My last.
Okay.
That chart.
Oh, okay. Okay, yeah.
Explain that to us.
Explain the chart. Okay, so this chart is by the CDC, and so this is how you can stop to prevent the spread of COVID-19. And they're nice pictures. It's on the CDC website. But you want to avoid close contact with people who are sick. You want to cover your cough or sneeze with a tissue, and then throw the tissue into the trash. You want to try to prevent touching your eyes, your nose, your mouth, especially when you're out and about and haven't just sanitized your hands. You want to clean the surfaces. All of these nice things there will help with that. You want to stay home when you're ill and not get other people sick. And then you want to wash your hands frequently, especially before you eat, after you use the bathroom, and for 20 seconds. That's the ABC song, or another long song that would help.
Amen. I call it "Don't Be Nasty" song. Let's not be nasty. Let's make sure that we overwash. And so, Carla, I thank you so much. And as I said, someone from the body of Christ, and someone that looks like us, talk like us, but yet is so educated, and you're able to bring it back that you can see it up close and personal. So I pray that you will gather your family together and look at this together, share this, because this is so important. There is no need in us suffering because we have failed to heed the warnings, or we failed to educate them and be knowledgeable about what we're facing. It is here, but in spite of it being here, as I said when I preached on Sunday, is that we must always be corona careful, but we're not corona fearful. We walk by faith and not by sight. But it doesn't mean we should be foolish. Let's be wise. And let's keep our eyes open for what God is doing. Because He wants to use you and use me and use us in such a time as this. May God bless you. May God keep you. And I'll see you next week right here at the kitchen table.